Hello everyone, myself Dr. Soumya Hullannavar. I'm a lead specialist at EliteAyurveda. I'm over here today to tell you about the difference between dandruff and psoriasis. I'm the consultant who takes care of the dandruff, but most of the people who does come to me will end up diagnosing it as a scalp psoriasis. So you should know what is dandruff and what is scalp psoriasis. So if your scalp starts itching, flakes, most of the time your doctors can say it is a dandruff or psoriasis. Let's say psoriasis is that particular disease that is like red scaly patches on your skin. If at all, unless you don't get diagnosed properly, then you will not be getting a appropriate treatment for that psoriasis. So let me just talk about dandruff first. See, dandruff that's a very skin problem. Once in a while, like everybody does experience that. So you may just start noticing the flakes that fall off your scalp. That may be just sometimes it will also cling onto your hair, and sometimes it may just fall on your shoulders or your clothes as well. So, and you will have that itchiness. Your scalp will have the itchiness. So first of all, you should understand what all can cause dandruff. So for example, first is seborrheic dermatitis. You would have heard about it. So that is a thing like oily, itchy, irritated skin that starts flaking off from your scalp. That is like seborrheic dermatitis, which will lead to a dandruff. That can also happen on eyebrows. People will say dust is coming from my eyebrows, sometimes the chest hair as well. So there is one more thing is contact dermatitis, we'll say. There are a few shampoos or some kind of things, some gels, some dyes and all that can irritate your scalp. And then it may cause into a kind of redness, itchy, flakes may start falling off. And there is a fungus, Malassezia, that's a yeast kind that thrives on that oil scalp. That could also turn out to be dandruff later. So sometimes if you don't shampoo your hair for a long duration, then also, yes, you may end up with a oily skin that can start flake off. Dry skin can also lead to a kind of flakes that will also lead to dandruff. So, and male hormone issues. Most of the time males will end up with the dandruff more than compared to women. The ratio is more with the males. So let's say the people who have a low immunity, they also tend to get HIV positive or cancerous patients. They also have autoimmune diseases. They are also more prone to get into dandruff. And one thing you have to understand is dandruff is usually treated easily, and you can also catch it from anybody else. Just you have your friend, your family people, they have a dandruff, you use the same comb, then it can just come off. And it is actually, it doesn't need, most of the time it will just come and go. You no need a particular medication for that. So these are all the reasons where you will end up with a dandruff. So let's come to psoriasis. See, psoriasis can also affect your scalp. That is again a red scaly patches. It can also start causing you the flakes off, just like how your dandruff does. But the main difference is you yourself can, most of the time people will miss out, maybe only a doctor could help you. But there are a few particular points if you are really a keen observer. First thing is, psoriasis will be most of the time chronic. So you should know what is acute and chronic. See, dandruff would just come today, maybe last for 3-4 days, and you started using some anti-dandruff or any antifungal shampoos or some oil applications, you can just get rid of the dandruff. You may not see the dandruff for again next 3 months or 6 months. Then it may come back. There is a chance. So that is dandruff. But psoriasis is not something like that. It is a chronic. It may start coming slowly. It may mimic dandruff, but it will not go off. One or the other time you will just have some of the other flakes falling, even though you try any home remedies or even though you try any simple shampoos or any applications on your scalp. That's a one difference you should be able to understand. Second thing is psoriasis will always have more scaly flakes. That's what I said. It is a bit difficult for you to understand, but still. It is same, both are scaly flakes only, but psoriasis will have a more serious, red and painful sometimes. Sometimes you may also feel the flake came out and it is painful, or maybe sometimes you may bleed also. You may itch so much that you will start bleeding. So then also you should be careful. It is not no more a dandruff. So one more thing major difference is like dandruff will come only on your scalp, and if it is a dermatitis fungal, which all leads to dandruff, I told you already. So that and all could be limited to a particular scalp area. But in psoriasis, gradually you can also see that lining spreading on your forehead, on maybe on your ear back, and you will also feel maybe a groin area and elbows, some small dryness on the knees. That will start. So you should be very observant to understand where all this dryness is starting. So always the scalp psoriasis and dandruff are completely different, and it needs a completely different treatment protocol. So hope you have understood the difference between dandruff and psoriasis. Thank you.